Hello, after years of working bedside, I finally made the big jump to start working as a new grad NP in the urgent care. And today, honestly, it's not been easy. There are some days it's just very hard. It's so stressful. But today, I want to focus on talking about the reasons why I do enjoy working as a nurse practitioner compared to working bedside as an RN. And I have 7 points. Please, in the comment section, you can drop your input, your own points, and I am open and willing to from you guys too. So I have my notes in my phone. I'm just gonna go through them. The first one, get to diagnose and make decisions. Right now, I feel like you're bedside. There's sometimes you're like, I need this lab, and the doctor's not putting it in. Like, you wish you could do those things by yourself, but right now I have that capacity to put in those orders. If I'm thinking X, Y, and Z, I know I want to do this, and I go ahead and I initiate that. But compared to being a bedside nurse, I didn't have that. And of course, I'm still working on their collaborating. But I have that capacity to make those decisions, to put in those labs, to put that prescription. But I promise you, as a new provider, it's also very overwhelming just because you keep on guessing with everything you're doing. Second point is variety every day. So in the ICU, we get 2 patients. They most of the times, regardless of their disease process, they're on critical drips. So it's like same things you have going on with your patients. But in the urgent care, I promise you can see 30 people with 30 different issues. A day you can have a rash, you can have STI, you can have strep throat, you can just anything. You can have a laceration that you need to do a stitch. So just everything. So you're constantly busy. Your mind is constantly thinking in angles. So you're definitely dealing with a whole lot of varieties compared to working in the ICU. Third point is you usually see patients improve. So in the urgent care, if someone comes in, IV, you have proof they cannot just stop coughing. They just have that very irritating cough. You can give them a steroid shot in the clinic, and boom, they'll feel 100 times better. You can also have someone come in, say with an STI, you prescribe them antibiotics, they go take it, they come back, they're feeling better during their follow-up. So you see people improve compared to the ICU, where you have people, let's say my 3 days of work, I have someone, there are people that can stay in the ICU for you don't get to even see progression of their progression, because they also get downgraded to step down, med surge. So you don't get to see full recovery story. And that's really sad, because sometimes we just want to know, because we have that connection with some of our patients, and we just really want to know to make sure they're doing better, but we really don't have that capacity to do that. Next one, think different types of stress. So in the ICU, we more stress because we have crashing, and they're doing stuff, labs, rapid infusions. So all of those things are happening. But compared to the urgent care, yes, we have coming other day someone came in symptoms, and we had to do call 911, because there's really not much of the supplies you need in TNK. You cannot administer that in the urgent care. You cannot do a CT scan. You cannot just things that we cannot do. So it's still stressful, but then boom, the EMS gets there and they take them to the hospital, to their where you're just your toes from start to the end of your shift. Next point, more autonomy. And it almost ties with first one I just spoke about. Get to use your clinical judgment more compared to working in the ICU. Use your clinical judgment, do what is right for the patient. If they need to put those in, but you cannot just do that working as a registered nurse, because it's out of our scope of practice. Next one, growth as a clinician. This one, let me see. Growth as a clinician, it's not money value. When I talk about growth as a clinician, I'm referring to you get so much exposure working with people with different issues constantly, and you just become a better provider. So you get to your skills, and also working as a nurse practitioner, you get CME, which you can use that to go learn different things. Here, I'm planning to go injections. I would like to do that. That's one of the things on my to-do list. I want to go learn. You can use your CME to learn things like that if you want to. So it's very interesting to me. And then the last but not the least, schedule for my lifestyle. I was back doing bedside. I work night shift, and when I tell you, that tore me up. I could not differentiate between night and day. I did not know when it was weekend or not weekend, because just seemed to be the same. I get back from work, I'm already so tired, drained, and I'm going to sleep. And before I know it, my alarm is going off, and I need to get up and go back to work. And also, bedside, you're so consumed with mindset of I need to pick up, because there's always something. They put up the shifts, and you feel you need to the one saving the unit, so you want to pick up also you plan all of this, make all your vacation plans, and you're like how much you need to pick up. So those things happen. But in the urgent care, I know there's a lot of like going on with, oh, but like pay is not that different from an NP versus a bedside nurse. I'll tell you right now, the pay is different, and like really not that need for you to like about picking up all these extra hours except you really want to. And again, in the urgent care, those like they're there if you want to use them. So you are still a nurse. What are your thoughts? Are you going to go back to school to get like advanced degree, be it NP or CRNA? Do you think it's not worth it? And if you're already a nurse practitioner, what specialty are you working in? Do you like it? I'd like to know, like, this is all I know, urgent care so far. And I'd like to know other people's thoughts, people who have worked in cardiology, or work like all the other specialties. Do you think they're better than urgent care? What are your recommendations? What will you advise someone like me who is still very new in this field to do as I progress in my career? Next thing for the next video, I want to talk about like loans and the different resources that are out there to help with student loan repayment. So please do not forget to like and subscribe to the channel, and I'll see you week. Thank you and have a great day. Bye.